Well, I think there are two important points to be raised about that. The first one is who needs to go on non-invasive ventilation at all in the COPD world? Because there was a long time there that all the data suggesting that putting patients on non-invasive ventilation didn't help, meaning the patients didn't feel better, they didn't live longer, they didn't cost less, nothing got better. Now we've learned how to do non-invasive ventilation correctly, which we didn't know how to do before. We use higher pressures and slightly different things. And if you do it right, now the data suggests that you're going to make the patient do better. Less hospitalizations, better quality of life, and things like that. So that's point number one. If you've got a patient with COPD who has chronic, meaning sustained hypercapnia, elevation in PCO2, those patients should be strongly considered for non-invasive ventilation. That's point number one. Point number two, though, is that even if by so doing, you're going to either save money or cost a little bit extra, but well within the range of what we consider cost effective. So the point, I think, is for a physician that manages COPD, if you find your patient is chronically hypercapnic, you ought to put them on non-invasive ventilation because it will improve their life and it will reduce costs for the healthcare system.